Thank you so much, Pramod, for kind introduction. And without much of an ado, I would quickly go into the topic that is given to me by the scientific committee. We have Dr. Shivkumar, the entire team, which has done a lot of hard work to put all things together. So the topic is pretty clear: precision oncology. How do you personalize the cancer care with AI? So today we are living in an era where the population medicine is now moving towards an individual patient. So the AI-driven revolution is actually shaping the cancer care globally. So the old ideology of one size fits all is now moving towards every patient is unique biologically, and how can we really give a precision therapy for each one, the right patient getting the right treatment at the right time. So I think with the evolution of genomics data, with the evolution of robotics, with the evolution of the molecular oncology and all that we have discussed right now, I think there is an amazing opportunity for us to tailor-make treatment for each patient and provide the right treatment at the right time for the right patient. So AI is now the intelligence layer that makes precision oncology scalable and actionable. So the reason why is it that one size does not fit all? 50% of cancer patients don't respond to first-line treatment. And the average cost of ineffective cancer therapies per patient is more than $200,000. And we have more than 10 million cancer deaths globally. So the traditional oncology model uses population averages, and every tumor is biologically unique, shaped by their genetics, epigenetics, tumor microenvironment, and patient lifestyle. So AI is now changing this equation fundamentally. So the AI inflection point is that because we have genomics at scale, we have advanced robotics, we have real-time imaging possible. We just now had a fantastic panel about the diagnostics role. We have targeted therapies available today. The big data and the electronic health records is coming in a big way. And of course, we have the advent of liquid biopsy, which gives you, much more details about the patient's disease in a more accurate way. So the inflection point, if you see, are there any benefits to the patient at the end of the day? Whatever you do, whichever technology you bring in, there is 30% improvement in 5-year survival for targeted chemotherapies. There is 50% reduction in unnecessary biopsies if you are doing AI-guided imaging. And of course, the cost is again reduced or saved even as we look at the adoption of AI in oncology. So precision oncology tells you what is unique about the tumor. AI tells us what to do with that knowledge. So it's more of an action-oriented application of artificial intelligence in precision oncology. So in the next few minutes, I'll try to take you through the role of AI in the precision diagnostics, precision target therapy, or the medical oncology, precision radiotherapy, and also topic of my interest and expertise, precision surgery, which includes robotics. So precision diagnostics, if you see, I think I'll quickly run through these slides because you've heard about the role of pathology and the radiology in a big way, through this morning session. So, you have so many applications today available. The application of AI in pathology, wherein you are saving time, you're detecting better, the accuracy is better, liquid biopsies are in vogue, and, screening is possible at population level AI, thereby, you're actually detecting lesions earlier, and you're able to save lives through that. So, again, as I mentioned before, for radiology, you have the AI for staging of lung cancer, or radiogenomics is coming up in a big way with the imaging and genomics. And of course, you also have the outcome forecasting based upon the images itself. So that's where the diagnosis is taking us. The key biomarkers, including the circulating tumor DNA, circulating tumor cells, and exosomes in a simple blood test is actually giving you a real-time tumor profiling. So you are able to do much more concordance of the tissue biopsies, concordances with the actionable mutations, much accurate, so that you are giving a right treatment to the right patient at the right time. I can share a small example of my neighbor who was diagnosed with stage 4 lung cancer. His routine tumor biopsy said there are no druggable mutations, and then we got a liquid biopsy done, and we found a rare mutation, which was ALK positive, and we put him on a specific target therapy. 3 years from now, almost 3 years now, he is completely doing well even in stage 4. So that's how the evolution of this precision therapy is helping us to give best outcomes to our patients. So multi-cancer early detection is the new norm. That's what we are heading towards, even as we detect cancers with simple blood sample. Instead of doing the traditional screening tests, you can actually detect them even with a simple blood test. So multi-omic integration is again another area wherein so much of AI is put into use. So molecular signatures are taken into consideration. The tumor microenvironment is mapped. The pathways are mapped very well, and you're also looking at the methylation patterns, radiogenomics, whereby you can also identify the tissue of origin, not just the disease. So in that sense, there is the AI-enhanced screenings, including the mammography, X-rays, colonoscopies, is also helping us to detect cancer early. So I have brought into a new concept, which is called as the precursor oncology. This is for the first time probably this word has been introduced, and this is something where we are looking at intercepting cancer even before it begins. So this is again now a new novel idea. The old paradigm is detect cancer early and treat, and today we are looking at how can we intercept cancer and treat it, prevent it from becoming cancer. So that's where I think we have an amazing opportunity to intercept, including the prioritization of the risk stratification. High-risk individuals are mapped using genomic data, the history, the biomarkers, even before any symptoms appear. Chemo prevention is something that we can look at for some high-risk patients, including simple medications like aspirin, tamoxifen, or finasteride, and you can have a surveillance protocols. You can also look at something called as lifestyle oncology, wherein you can actually intercept cancer even before it comes. So that's where I see a great opportunity of AI in genomic risk scoring, liquid biopsy analysis, imaging AI diagnosis, pathology AI, predictive modeling, and of course, clinical decision support that is available. Now, moving on to precision therapy in medical oncology, I think my friends from Google would appreciate much here how the AlphaFold and what they have done, the pioneering work has made such an amazing opportunity to develop personalized vaccine for cancer. For the man's best friend, dog, beloved pet of Paul, who was a technologist like many of you. He went on to create a personalized vaccine for his pet's tumor, and and his pet is doing well. So that's where I think the precision medical oncology is moving in a big way, right from liquid biopsy to next generation sequencing, genomic profiling, and biomarker matching. Personalized drug is selected. Circulating tumor DNA is for monitoring whether the disease has completely gone or not. Thereby, you're actually giving an adaptive therapy to the patient. So if you know in medical oncology, the targeted therapies, you have hundreds of FDA-approved targeted therapies available. AI helps us to do that matchmaking, the right drug for the right patient. So that's where I think we have an exciting times ahead, even as we use a lot of artificial intelligence in the clinical scenario. So AI also predicts the drug resistance so that you are staying ahead of the tumor. You can actually, take care of the problem of drug resistance by giving the right drug, and by identifying which combination of drugs will work, which kind of predictive modeling is good, surveillance by liquid biopsy. That is something that is making a big change in the way we do the medical oncology practice. So drug discovery and repurposing again is another opportunity of the use of application of AI in precision oncology, wherein you can actually generate the molecule design. You have repurposing possible, digital twins possible, and of course clinical trial design. I think we have an entire session in drug discovery in the next hall. So precision immunotherapy is something that again is tailored, specific medication is given to that patient based upon his molecular profiling or the disease that he has. So AI is helping us to focus on the right patient at the right time. So I think we had amazing discussion on the AI tumor board. The vision that looks like in the next 4 years, I would see the patient comes in the morning, the sequencing is done, mutations are identified just by 1 p.m. The oncologist reviews and approves, and the treatment is started. So you're saving time, you're giving more precise, personalized care to your patient. So precision oncology is actually a great equalizer as well, and that's where my heart goes in. How can we provide the best care even in low resource settings, federated AI learning, digital pathology equity, language independent artificial intelligence, bias correction, and of course through the mobile technology, you can reach the unreached with this technology. So the future of medical oncology, the targeted therapy is mainly proteome-directed therapy. You're looking at an era of living drug prescriptions, wherein you have a real-time understanding of the disease status. You're looking at a synthetic lethality at scale, and of course for clinical trials, the PK/PD dosing can also be done with the help of AI. So quickly going to the section of radiotherapy, how precision oncology is making a difference in the way we treat. I think in radiation oncology, one of the important things is contouring or the planning for delivering the radiotherapy. That's where I think the transformation is happening in the way we plan the workflow. So there is a time reduction in the planning, there is a consistency in the planning, across multiple centers, you can have a consistency, you can target the volume accurately, and this is where the human and AI collaboration is enabling us to reduce the side effects and target the area and deliver the treatment. So that's where the efficiency is improved, accuracy is much better, and of course the fusion of CT scan and MRI is helping us to deliver the therapy at the right time to the right patient. If you see in this video, even as through innovation, how we are evolving with these models, the tumor on day 1 is of one size, and the same tumor on day 2 will shrink. So then, with artificial intelligence, it will automatically contour, adapt to the required. So on day 2, the tumor now is different, and now the adaptation happens real time. Every day MRI is being done. Thereby, you're actually giving the right treatment to the right targeted area. Daily you're imaging. So again, the tumor shrinks further. And now on day 3, again, the planning is exactly to the area where the tumor is. That's how the technology is helping us to give the right treatment. So adaptive radiotherapy is real-time AI on the treatment table. You do a daily MRI. That's the machine that we use right here. MRI Linac, the country's only precision radiotherapy machine, I would say. So you do AI contouring, plan adaptation, you do the gating, and you deliver the dose, all without losing much time. Traditionally, it takes about 3 to 4 days, but now within few minutes, you're able to deliver. That's where, the evidence is enough to say that in multiple areas across the body, there is a benefit of giving precision radiotherapy or adaptive radiotherapy, which is guided by MRI. So the strike is accurate. Precision strike is what is possible. Even as we, look at this video, the wherever the tumor is, it will spare the normal organs, and then it will deliver the therapy at the right place. So I'll quickly go on to the subject of much more interest to me is precision surgery, paradigm shift in surgery. You see from robotics, we are now moving towards AI-driven surgery. So open to lab to robotic to the fourth, I would say this is the fourth epoch of surgery, in Dr. Michael's words, if I had to put it, right? That's where we are moving from robotic to, AI-driven surgery. So the next generation of surgery is going to be intelligent, it's going to be highly intuitive and incredibly precise. So what a good surgery makes, actually, what makes a good surgery, right? Patient preoperative state, patient outcomes, objective insights, skill of the surgeon, and of course it is helped by 3D models, advanced staplers, simulators, and telepresence so that you can proctor and train the next generation of surgeons. So what is the real difference during the surgery? If you see here, with robotic surgery, such a precision, you can literally catch hold of red blood cell is what I always say. That's how accurate the surgery is. So bloodless surgery and highly accurate, you preserve the nerves, you preserve the anatomical structures, and do a complex surgery, minimally invasive with a small micro, incisions, you're able to perform such complex surgeries. Whereas in, laparoscopy, it is not going to happen that way because you have a 3D vision, you have 10 times magnification, and you have you can do precision surgery. So in laparoscopy, literally, those of you who are laparoscopy surgeons here would appreciate with me, you shout on your assistant so much that, you come close, you don't shake, you turn right, turn left, all that. Whereas in robotic, the assistant literally sleeps, actually. That's how the surgery is going to be. So if you look at this precision surgery here, this is a, surgery done for a tumor in the left kidney, a partial nephrectomy. Now you see that you are able to preserve the organ because you are doing a better imaging, you are better doing a 3D analysis of the disease, and then do organ preserving surgery. So that's where again big is not the right answer for every tumor. So now even small cut or small surgery is also oncologically same or effective. That's how we're able to perform even a complex surgeries with the help of this technology and robotics. So 3D printing helps us to do a rehearsal much before. So this is again for a tumor in the left kidney. So the virtual navigation happens, AI integration helps us to plan, to understand the anatomy of the patient. This patient has got 2 renal arteries, so you know better what is the abnormality. You're better prepared to face the surgery, and that's how you're able to give a precision outcomes to your patient. So preoperatively, intraoperatively, and postoperatively, there is a big role of AI in digital surgery. So one of the advents of the technology that we have is near infrared fluorescence that is helping us to do less for those patients where there is no lymphatic spread. So augmented reality overlay, AI real-time pathology, autonomous stapling, and mapping of the blood vessels and the nerves, And of course, the cognitive load monitoring is helping us to give the best care to our patients. So here you see the perfusion is better assessed by a fluorescence imaging with the robotic equipment, wherein you know whether the blood supply is good, whether the tissue is going to survive or not. You can easily identify even before you close. Sentinel lymph node, again, the first draining lymph node of cancer, you can identify with this technology of indocyanine in green, and you're able to send this for a frozen section, and if this node is negative, then you can avoid an unnecessary lymph node clearance. So sometimes less is more. Initially we used to be more radical for all cancer surgeries, but today we are moving to a conservative surgeries were required. Similarly, identification of thoracic duct, again, that's a very morbid complication for esophageal cancer surgeries. That's where you have this advantage of sentinel node biopsy. The ICG dye is given and the thoracic duct is identified. So AI-guided precision intraoperatively is possible. You can actually have the navigation. You can go to the area of interest through the AI-guided navigation, and precision targeting is possible even for small nodules in the lung. So smart stapling, again, which tissue, which stapler to apply. The technology is so much evolved with AI, wherein with the algorithms you're able to know the right tissue and the right reload for applying this stapler. So that's where, again, technology is making a big difference. This is a case of right lung lower lobectomy. You see how the robotic stapling has really revolutionized the way we do the lung cancer surgeries, with minimal invasion and the best outcomes to our patients. So that's how you see here. The simplest example is to see that the staplers are they have the algorithms wherein you can have a smart stapling mechanism that helps us to choose the right reload to fire. So multispectral edge is what we are looking at. The future, visualizing the molecular signatures on table non-invasively. We are looking at intraop navigation. We are looking at robotic feedback loops again. 40% of the haptic loss what we right now don't have with the present robotic system is now possible with the technology that's available. So predictive surgical analytics is possible. There is a good computer vision so that you can recognize the tissue better. And of course, shared autonomy is possible, wherein you have a shared robotic control. So multiple places, a proctor can guide somebody in a remote place, and they can learn this surgery and they can be taught. So digital twins, the virtual rehearsal for a surgery happens. So patient-specific rehearsal is possible. Real-time data fusion is possible. Recovery and complication modeling or prediction is also possible with the advent of this technology. So just to take a small example of AI-guided robotic prostatectomy, what is the real difference with the outcomes? You see the standard versus AI-driven, you see the outcomes. The positive margin rates are much less with AI guidance. Nerve sparing rate is much better. Continence rates are much better with AI-driven. The erectile function preservation is also much better. The operative time is also less. So that's where it is making real difference. The future is towards nanorobotics. We are looking at an era wherein you have a propulsion-based therapies, or micromotor technology, which can go to the area of site of the disease and do the targeted treatment. So nanorobotic technology is in vogue, and we're also looking at an era of nanosurgery, wherein with instead of doing a major grotesque surgeries, you're able to do nano-sized surgical instruments will go in and will perform the surgery. That's the era that we are looking at. The next leap is going to be telesurgery. Next leap is going to be telesurgery, and it's already happening. And India can lead this, globally, it can lead this opportunity. And I feel I want to conclude with this, that AI is right now in clinical use. It's not about tomorrow. Across all pillars of oncology care, precision diagnostics are shifting the cancer care from late-stage crisis management to early precision intervention. And of course, robotic AI surgery delivers much better gains in precision and outcomes to the patient. Adaptive radiotherapy helps us to treat the patient much faster and much better. So precursor oncology, as I said, is a new concept, new frontier to prevent cancer. And AI is here to enable hyper-personalization. Personalized precision care is a new norm. Ethics and equity must be central, not afterthoughts. And global collaboration, events like this will help us to work together and make an impact. So the oncologists of future will not be replaced by AI, but they will be empowered by it. Thank you so much for your patient hearing.
Thank you, Dr. Chinnababu. I request you to kindly remain on stage, and I request the chairpersons to please coordinate the Q&A.
Overview of applications of AI in particularly in oncological field. It was again, I congratulate you for that. But if we recollect, recently one of the top US businessman, Elon Musk, told within 3 years, all robots will take over the surgeons. So what's your take on that? How do you feel? How does, the human skills or human whatever factors like empathy, the way we talk to the patients and all those things can be compensated by AI?
No, I think we are really, there's a disruption happening, Dr. Narendra, for sure. Thank you for the question. But right now, I think we have a semi-autonomous robotic surgery, but fully autonomous robotic surgery, I think it will take some more time. I don't think, we need to prove beyond a reasonable doubt about the safety and take it forward. So I think there is an era for surgeons to work from home, basically with telesurgery. So you can sit at the home and you can perform surgeries, but I think, it still takes some more time to have a fully autonomous robotic surgery. It is not still, it takes at least quite some time, yeah. CM Bhai.
We can have one more question, please. Yeah.
Hello. Chinna, best talk, and I like to share the memories me and Chinna and Narendra had when we did our MCH program together. And we're really proud that you have grown to such an extent that, by your abilities, you are bringing technology to Hyderabad and via Hyderabad to India. Thank you very much.
Thank you,
and
sir.
again, the concern, the AI, even though it's coming in a big way, what I hear is that whatever we are witnessing is baby AI. The real AI is going to come with quantum computing and all. And another thing is that all these developments which is happening at various levels, platforms, are a bit confidential. So when I visited the Google headquarters in San Francisco, I think they never allowed me to, any of us to go anywhere other than to drink a coffee in a coffee shop which is near their research facility. And if so the concern here is, now we have a good number of medical students, surgeons training the conventional way, and whatever development is going to come in a near future is pretty much different. It is not the way we used to practice medicine. And how we are going to address that issue, because unless we train them properly and make them vary or change according to the AI, the medical curriculum has to improve. Otherwise, I think we are going to get doctors who are badly equipped to deal with AI.
No, I fully agree with you, CM Bhai, because I think that's why Dr. Pete is going to have a separate session tomorrow on the medical education, the training itself, and how we need to relook at the way we, train our students in the next generation. I think, I look forward to hear Dr. Pete's talk. Yeah,
great,
thanks.
nice meeting. Any?
There's just one more question, if we can make it the last one, Ms. Sunita.
Oh.
Dr. Chinna, you am a robotic surgeon, and you more than anybody else knows the human element that is required for a surgeon, especially when it came to my own case. So what are the 2 things that you would like to tell every surgeon sitting in this hall that they should understand about the limitation of technology, where the human hand precedes the technology?
No, I think that's a right question, Sunita. Thank you. I think technology is here to empower us. I think the human touch cannot be taken away by technology. Spending time. So AI is helping us to save time. That's what we're discussing the whole day, right? What will you do with the saved time? That is the question that we need to ask. So if I save time, I will spend that time by speaking to the patient. I will show my compassion. I will communicate, give hope. I think that's where time is going to be useful. Thank you.